Welcome back to Metabolic Mind, a nonprofit initiative of Bazooki Group, where we focus on the intersection of metabolic health and mental health, and metabolic therapies like ketogenic therapy as treatment for mental illness. I'm Dr. Bret Scher. Today we're continuing with another really inspiring individual story of someone using ketogenic therapy to treat their serious mental illness, in this case bipolar disorder. I had the pleasure of interviewing Kit Kaiser, and this was at the 8th Global Symposium on Ketogenic Therapy. So it was an international conference, mostly scientists and researchers, but there were a number of individuals who had lived experience of using ketogenic therapy to treat their serious mental illness, and Kit was one of them. And I was so fortunate to have the opportunity to sit down for this brief interview with Kit, because really he embodies what we're trying to do. We're trying to provide the information and the resources so people can evaluate if ketogenic therapies is an appropriate treatment for them, and hopefully give them hope and show them a way that they can live fulfilled and full lives despite a diagnosis of a serious mental illness. Now, but remember, this is for informational purposes only. We're not giving any medical advice or establishing a provider-patient relationship here. We want you to learn from our information and bring it to your healthcare team to see if it's the right approach for you. But doing things without proper supervision, changing your lifestyle, or certainly your medications, is not recommended without full buy-in with your healthcare team. So please learn from this, get inspired by this, but don't take this as medical advice. Okay, now with that as the intro, let's get on with this interview with Kit Kaiser, who you can find on Twitter or X and Instagram at KITKEYSER. Well, Kit, thank you so much for joining me here to sort of share your experience with ketosis and mental health and what it's meant for you.
Yeah, thanks for having me.
Yeah, so we're here at the 8th Global Symposium on Ketogenic Therapeutics, and it's such a great title because ketogenic therapeutics, the therapeutic intervention of ketosis, which can help so many things, which really the reason why all these researchers and clinicians are here are to find ways to help people live better lives. So I'll just use that as a general opening for you. How has ketogenic therapy helped you live a better life?
I'd say there's a variety of ways. I've been able to go off my medication for an extended period of time. Yeah. So that's big, but I think the bigger part is it's working better than the medication. Mm-hmm. So let's rewind for a second. What were you on medication for? Let's just start this is for bipolar type 1.
Yeah. And so, the traditional treatment is, lithium and then maybe some antipsychotics and possibly even benzos. Like, have you been on a mix of all those different types of medications?
Yeah, so didn't take them all because there's a lot, but I've been on antipsychotics and different mood stabilizers.
Yeah.
I think they do work and have their purpose, but there's a lot of negative effects to taking those. So.
Yeah, right. Like that's what things we talk about a lot, that medications can be life-saving and definitely have a purpose, but are not without their adverse effects. So how did you first come across ketogenic therapy as a potential treatment for bipolar?
I think I was just reading about it because some people were talking about it as a trendy diet for weight loss, and they'd say things like mental clarity.
Yeah.
It was just an interesting thing to read about, and then I learned about it being related to epilepsy, mm-hmm. and treating epilepsy, and it just it was an idea. It's well, I take an anti-epileptic, would that work for me? So
you had to connect the dots on your own. It wasn't because a doctor or a dietitian or a coach or anybody sort of brought it to you. You connected the dots on your own, huh?
Yeah, I just reading and learning. So it's just an interesting topic to just learn about, I guess.
Yeah, I mean, that's so amazing. But something that we don't want to have to happen, right? How many people are out there in your same scenario who aren't as investigative as you, right? Who aren't connecting the dots, that we need the clinicians to do so. So once you started a keto diet and got into ketosis, what did you start to notice?
I think the first thing I noticed was probably a small amount of weight loss. Mm-hmm. So the drugs had made me gain a bunch of weight, and then slowly got to a maintenance dose. But I was still 20 pounds heavier than I was before any of it. Mm-hmm. So it wasn't that big a deal, but being able to just lose that and get back to where it was before felt good. So that kind of increased my mood. Mm-hmm. I'd say it's just been a slow, gradual improvement in my health over that time.
Yeah. Now I'm curious, as you're, getting on the diet and you're starting to feel health benefits, both from a weight and a psychological brain standpoint, did your doctors or your care team notice, and kind of were they curious as to what you were doing to start seeing benefits?
Well, we discussed it before I went on the diet.
Good. Okay.
And yeah, I pushed all this research to the doctor, and it was interesting. It was like she wasn't against it, but the idea that it could be used instead of a medication was like a bit too far-fetched. Yeah. Needed to be researched a little more. But.
Right. I mean, that's a great example, though, because we hear from so many people, like, I can't find a doctor who knows about this. And sometimes it is up to you to help educate your doctor. And that's certainly part of what we want to do at Metabolic Mind, is to provide those resources, but also to point to the research. Like you said, you came with research, which I think is so important for a doctor to be able to see what's out there and then to work with you together on this. And tapering off medications can be a very challenging thing. And we have a whole video on that about how it has to be done, as part of a care team, and very slowly and carefully. What kind of advice can you give for people if they want to even try that or consider it, to, how to do it safely and appropriately?
I think the biggest thing is working with your medical team. Yeah. And going slow. Like, I think it was a little bit over 6 months for me to taper off what I was already on a low dose. So it's like the slower you can go, the better. And that goes for anyone. Like, it could be someone who's just trying to get off like antidepressants, and it's too many. Like, you just hear too many stories of people quitting too quickly, and then you have a rebound, and you end up with side effects and like all different things. So
yeah, definitely that rebound effect is something to be wary of, for sure. Now, looking back to when you were first diagnosed with bipolar disorder and how that changed your life, the way most people are taught and told is that this is a lifelong disorder that's going to come and go, and you just try and manage. So one, is that what you were told? And then if so, how do you feel now reflecting back on that from where you are now?
Yeah, I think that's what I was told. I was also told, I'd have to be on medication for the rest of my life. Yeah. And I was fine with those. And my mood was stable before I started all of this. But yeah, it's just kind of it's interesting to think about it now, because it's like, holy crap, this does work. So, and I'd say it's worked better than I could have imagined it would.
Yeah. Yeah, and you said earlier you think it works better than the medication. So tell me what do you mean by better?
My mood's pretty stable, but when I was on medication, it was probably stable at a lower threshold. So I was fine. Yeah. But I would say now I just healthier in general, happier and able to do a lot more. And then I think a big improvement, I have a condition caused by antipsychotics. It's a movement disorder, and that over time has improved. And it's hard to know, but I think not being on medication helps, and just being healthier in general kind of helps. So who knows if ketosis has healed that or not, but just all these combination of factors that made those.
Yeah, I think that's a great point, though. And also sort of this concept of the healthier you feel, the healthier you are, and it's sort of like a good spiral. Like you said, you lost the weight and you felt good about that, and maybe you got more active, and you just sort of, that in itself helped your mood. So a lot of this sort of adds on itself. And we see pictures on Twitter, you out there riding the foil board and being active, and I mean, that's just got to feel like a new lease on life in a way.
Yeah. Yeah, I think before, I would do all the same things, but now I kind of just do more of them, if that makes sense.
Yeah.
So it's just kind of cool.
Yeah. Now, you're one person having gone through this, but your story can impact so many people. So what do you hope people listening to this or watching this will sort of take away from your experience?
Probably the biggest thing is in my mind, there likely is a better way than what we've previously been doing. So, And I think it's more than just the ketogenic diet, but I think there's a bit of hope for people. So
Yeah, that's a great way to say it. Some hope for people, because unfortunately, so many people dealing with bipolar disorder, schizophrenia, other serious mental illness probably lose hope, and understandably so. But this is something that can hopefully give them hope with stories like yours. So thank you for taking the time to join us and to share your journey and your story with everyone.
yeah, thank you. And can I add one thing?
Sure, please.
So I think that it's like pretty much one of the main reasons I started doing this was to see if there was a treatment you could, like, people would want to do. Because there's a lot of reasons why people don't want to take their medication, and whatever side effects, or like they don't want to do the thing they need to do. So I think this diet is super cool because, like, I want to go eat like a steak for dinner or have a coffee with a whole bunch of like cream in it or something delicious. So I'm like motivated to have my treatment. And you see so many patients, they're really motivated not to have their treatment, like hide the fact that they're not taking drugs from their doctors and stuff. So
Yeah.
I think it's like just just a life-changing treatment.
That's a great way to say it. All right. Thank you for adding that.